Hey everyone, welcome to episode 49 of Your Ultimate Comeback. Excited today. I'm sitting here with Gino Lombardo. Did I say your last name right?
Yes, you did.
I was going to ask you that for the podcast, but I forgot.
Give it a shot.
Yeah. Hey, we're going to be exploring everything peptide-based. Gino is part of a company called Beyond Wellness, so super excited for that. But before we jump in, Raquel is not here again this week. She's watching her daughter play volleyball. She has a special message for all of you, so we're going to go ahead and play that real quick for you, and then we'll get after it.
Hey guys, Raquel here, just saying hello. Sorry I've been missing you guys for the last couple of weeks, but it's been for a good reason. Been fortunate enough to be able to see my daughter play some preseason beach volleyball for Cal Poly, and I will be back in studio next week with Brad, so I look forward to that. You're in great hands with Brad and Gino today. That's going to be fantastic. Sorry to miss it, but I'll see you all soon.
All right, we miss Raquel. Can't wait to have her back in the studio next week. But I'd like to introduce to you all Gino Lombardo from Beyond Wellness. Gino, thanks for joining us, man. Excited to have you here.
Of course, excited to be here.
Yeah, so we're going to jump in and explore peptides. For those of you that haven't heard about peptides, they're kind of this new rage in the industry. I've played around with a bunch of them over the years and just really excited to help give everyone an overview of peptides, what they are, what they do, the different categories of peptides, and how people can use them. So start with Gino. What in the world are peptides?
Peptides, we all have them in our body. There's about 7,000 different ones in our body.
Are there really?
Yeah.
I didn't know that.
So basically they're short chain amino acids. They're anywhere from 2 to 100 amino acids. It gets complicated. It's like 2 to 50 is a regulator, 50 to 100 is a peptide. But they kind of just fall all into the peptide realm. Anything over 100 is a protein. So basically what they do in the body is they signal to your cell to upregulate or downregulate something. So they're all signaling molecules. You have, like the muscle building ones that are going to tell your pituitary gland to upregulate the release of your growth hormone. You have, your weight loss peptides. You have your BPC-157 that's going to help, heal. It's going to help grow new blood vessels, grow new soft tissues. Helps with the gut as well, like growing the inner lining of the gut, helps with Crohn's, all that kind of stuff. So there's, I think there's like somewhere around like 70 plus, might be wrong there, but we obviously haven't gotten them all into injectable form, but there's much more research to be done, much more peptides to come out with. The world of peptides is crazy and it's going to keep growing, and there's a peptide for everything, really, and there will be.
Yeah, and probably the most common one people know of in general are the weight loss ones, the semaglutides like Ozempic and things like that. Mm-hmm. So let's start off with that one, or that category. Can you give people an idea of what these things like semaglutide, Ozempic, the GLP-1 stimulators, like what is it these things are doing to help people lose weight?
So they're gonna decrease the appetite. They're gonna regulate your insulin, so help with those blood sugar spikes. They slow gastric emptying, so that's going to make you full faster. You do hear, they might have like some digestive discomfort, nausea, those kind of things. Very effective, but they definitely need to be like closely regulated with your lifestyle. A lot of people get on them, have them as a cheat code, and they end up, being comfortable eating 500-600 calories a day.
Right.
And as you know, that's no good. Body's cortisol levels go up. You hold on to visceral fat. The most calorically expensive thing in the body, the muscle, is your body's like, hey, we don't have room for this. And then you lose muscle. So you've heard a lot of that, like, oh, you're going to lose all your muscle. Girls talk about losing like face structure, all these things, losing your hair. That's all based on like malnourishment. Like you're getting 500-600 calories a day. You're not giving your body what it needs. Of course, the body's going to break down. So in our clinic, we kind of not play around with it, but I don't really go to the high doses. Yeah. That just makes people not eat at all. Yeah. I stick to like a low dose. It's usually effective. And then you could kind of use it as a tool. And then, so, you could go to the gym still, you could have energy to work out. You could still eat the right amount of protein. Like protein intake, resistance training is huge during that. But lots of people, lots of clinics, lots of doctors are just you see all over online. You could just get it,
Yeah.
And so many people are on it and they don't have any direction or coaching or anything. And then they're just not eating and they're losing weight. But if they did something like a DEXA scan or InBody, you'll see that they're losing more muscle than they are fat.
So someone that's taking those, if they're using a lower dose, still able to eat enough protein, they lift weights, they do all the lifestyle things for a healthy lifestyle.
Yeah.
That's a pretty effective tool, I'm learning.
Yeah, it really is. And you have like the FDA guidelines like under 30 BMI. So this is really for, like just to backtrack a little bit, like semaglutide GLP-1 is for diabetes, for type 2 diabetes. So, they found that it's helping with weight loss, obviously, and then it's this huge craze. Tirzepatide is GLP-1 and GIP, two different mechanisms there, and it's a lot more effective. There's less side effects. But yeah, you really got to pay attention to what you're doing around that. It's not like a cheat code. I mean, as well as I do, you need to get your sleep, your diet, your exercise all in line before you can optimize yourself.
Right. Well, can people stay on this for long term? I mean, what are these people that are getting on it, high dosing it, not eating, not exercising, losing all this weight? At some point, there's gonna be a negative side effect, right? With all that sarcopenia, the muscle wasting. I mean, can they? I have no idea. I'm just asking.
Yeah.
Can people stay on this for long term? Like, what do these people do if they have to come off of it?
So you should, like every peptide, you really should cycle it and get off of it, and it will, your body will get desensitized to it. I would say for somebody that's really obese and really has type 2 diabetes, it's, okay to stay on for a long time. If you're doing it for muscle or for weight loss, I would do it in like a 4-month cycle.
And then come off it for a while.
Take that 5th month to taper off of it as well, because what's happening is, these and most clinics and like things you sign up with online, it's like an indefinite.
Yeah, it's a monthly subscription. They want you on as long as possible.
Yeah, exactly. And I mean, that's good for their pocketbook, but it's not good for the end user. So, the best way is to get on it, get off of it, lose your weight, be dialed in on those, while you're on it. But, cycle off of it and also taper off. Because a lot of these, you get cut off, and then all of a sudden you're starving because your appetite's back.
Yeah.
And then you gain your weight back.
Because the rebound effect's going to play. And now you have less muscle mass. If you didn't do the weightlifting, the protein intake, you have less muscle mass. So your metabolism is actually slower.
Yeah.
So you'll start eating more food. It's going to be a pretty nasty rebound effect.
Yeah, and I would say 80 to 90% of people are doing it wrong.
Yeah.
Not many people are doing it right.
Yeah. As I've been kind of watching it for a while, I know it's not going away.
Mm-hmm.
That's kind of the thing that I'm seeing. And I'm learning there's very effective ways to use it.
Yeah.
And I'm all for that, effectiveness and using those things to bump start or create a positive response. That's one of the things I love about peptides is you can get on them and come off of them.
Yep.
But what I'm seeing as I talk to people using them and I see people using them, it's the only answer.
Yeah.
And now they're not eating, they're not exercising, they're losing weight fast.
Yep.
And then it gets to a point where people are like, what the hell's wrong with you? They're like, are you sick?
Yeah.
But I've watched people use it in lower dosages, lifting the weights, eating the protein, still having an appetite. And it's phenomenal how it works for them.
Yeah. And I've tried it, and it's literally, I did like 3 milligrams, and which is like the low dose. And there was a day, like when you get closer to your next shot, it's a weekly shot, your appetite starts to come back a little bit.
Yeah.
But I was uncomfortable doing it because I was literally like have to force myself.
Yeah.
And most people, that want to lose their 5 to 10 pounds, or, a lot of, especially women, think they're overweight when they're really not. But, they'll do it and they'll be happy with the fact that they're not eating, and then they're just looking at the scale.
It's dropping like crazy.
Yeah, exactly. But you gotta, and like you talk about it, like a pound per body weight, you gotta get that in protein wise. And that's tough.
Yeah.
If you don't have an appetite, that's crazy. Most people are under eating, and they do have that fat because they're starving themselves.
Yeah.
and then they get on something like this, and then they're starving themselves more. Fat goes up, muscle goes down.
But the scale's going down, so they're happy.
Yeah, and it's not for those people. Like,
Yeah.
I do my best to recommend, like, hey, like, you don't need that.
Yeah.
You need to eat.
Yeah. Well, I thought it was interesting. I learned a couple weeks ago, I think I shared on the podcast, that one of the benefits of eating enough protein, the 1 gram per pound of body weight, naturally stimulates more GLP-1. And that's why people have less cravings. They're less hungry. It's easier to sustain a healthier diet. And they'll lose weight that way is because they're getting the natural stimulus of more GLP-1 than normal.
Interesting. Yeah.
I thought that was super fascinating.
Yeah, that's awesome. And anytime you could ever get your benefits out of eating the right food, like, that's the best way to do it, right? And like, get that GLP-1 in you naturally, and get your, and even like eating protein, like, the satiety is like crazy compared to like you eat a steak, you eat a bowl of pasta.
Yeah, it's very different.
You can keep
response.
on eating that pasta.
Yeah.
Somebody puts a dessert in front of you, you're like, oh, I got a little room for that. When you have your steak and you finish it, you're like, I'm done.
Yeah, I'm good. I like that. Okay, cool. Thanks for the overview. The next one I want to talk about, and we're going to kind of rip through these because I'm really interested to help people understand all the different avenues there are. NAD.
Yep.
This is another big one that a lot of people are using, a lot of people are hearing about. Tell us a little bit about NAD.
NAD it's one of my favorites. Just came on, started getting popular like 6-8 years ago, something like that.
Something like that. I've been hearing about it for a while.
Yeah, so your body has NAD in it, just like peptides. It's the precursor to make your body's energy. Don't want to get like too in the weeds, but the powerhouse of the cell, the mitochondria, it utilizes NAD to make that ATP. Once we turn about 30, 35, same deal with peptides, we start making less and less of it in the body. And then that correlates with aging, right? Your body, whether it's a skin cell, liver cell, heart cell, brain cell, it needs that energy to do what it normally does. So getting the injections or IVs of the NAD into the tissues, then your body has more NAD, has more energy. So if it's helping at the cellular level, then it's going to help all across the body with energy levels, inflammation, sleep, performance, across the board. It helps.
Yeah. And you said there's multiple ways to take it. You can do it via IV. You can do it via intramuscular injections. Is that right? And then also subcutaneous or fat, like into the fat.
Yep.
Yeah.
Yeah. So we do all of them at Beyond. The higher doses, 250 milligrams, 500, 750, 1,000, all done via IV. And that's what kind of, when it came on the map, it was all IV. And then also like 100 milligram shot IV, or not IV, my bad, intramuscular, or 200 milligrams. And then the sub-Q shots are anywhere from like 40 to 100.
Okay.
And that's, it started out as like the popular thing to do was do 1,000 milligrams once a month. But by the time you went and got your next IV, you're kind of depleted of that. So keeping the peak blood levels up with it and doing it more frequently, I think is better. I do the sub-Q shots, and I've been absolutely loving that. But sub-Q is more frequent, like 3 to 7 days a week. You have your IM injections of 100 or 200. That's once or twice a week. And then the IVs will be like once or twice a month.
Gotcha.
Yeah.
And the IVs, it's a pretty long process, right? If you get the IV.
Yeah. So
I've never done the IV of it. I've only done the subcutaneous.
Yeah. So the 250 is going to, and everybody's different, right? With everything. 250 is going to be about an hour and a half, 2 hours. And then it goes up from there. And 1,000 milligram IV could, depending on the person, could take anywhere from 2.5 hours to 4 hours.
Oh, wow.
Yeah. So we got a little room with the TV and the couch, make them comfortable. But yeah, like a normal IV is 40 to 45 minutes.
Yeah.
But for this, you got to slow it down because NAD is derived from niacin, vitamin B3.
Oh, so you flush.
So that's where that flushing comes through, pressure in the chest, which the nurses, I'm like telling them, about it. And then I'm like, yeah, they might feel pressure in the chest. They might feel heart rate flushed. And like, that's nothing you want to hear, right?
Yeah.
Like pressure in the chest. That's normal.
Yeah.
But yeah, you just got to kind of flow it, communicate with the provider, and just like flow it however you're feeling comfortable. Sometimes if you go slow enough, you're not feeling it at all. But time is money, right? So I've done 1,000 milligrams in 2 hours or an hour and a half, and it was very uncomfortable. But so it's like
that flushing feeling is horrible.
It is. It's not. Yeah, you get all anxious and sweat. Yeah, it's no good.
Yeah.
But I love NAD. Personally, energy levels are like level throughout the day. You know, no crashes. Obviously, diet plays a lot with that. Sleep's better. You know, mental clarity. It's just, it's really good. I love it.
Well, 'cause as the mitochondria starts to become gunked up and not function well and not produce as much energy, that is another thing that accelerates aging, right? Mm-hmm. So NAD will help kind of clear all that up. And
it's kind of sold and marketed as like an anti-aging molecule.
Oh, okay. Gotcha. But really what it's doing is just helping the mitochondria become more efficient.
Yep. All across the body. Every cell's got a bunch of mitochondria. So it doesn't differentiate, whatever cell it is, every cell's working better.
Interesting.
Yeah.
So it just provides for a little bit better life as you get older.
Exactly.
I like that. I remember being younger and hearing like the biggest difference between like a young kid and an adult is how gunked the mitochondria just starts getting gunked up as we get older. And so we have less energy. That's why children can run around like banshees and never get tired.
Yep.
And adults, we need naps and breaks. And
and they heal better. And it's like, I think that's kind of like, the cellular levels where it all starts, right? But then other things get gunked up, because of that.
Yeah. Interesting. All right. Sweet. So we got the GLP-1s, we got NAD. How about people are starting to hear more and more about the healing peptides like BPC-157, TB-500. Is that right?
Yep.
Tell us a little bit about those different types of peptides.
Yeah. So those, BPC is another one of my favorite. And just a clarification on peptides and why you need to inject them. That short chain amino acid, it gets broken up real easily. So when it goes through the digestive system, it's, no longer working. So like BPC-157 in the oral forms, definitely not as effective. Maybe in the gut. Yeah, because it does, like BPC-157 is derived from your gut. It's like a fragment of a peptide found in the stomach. But they found when, they take it out, you inject it into, the subcutaneous fat. It is the only peptide you can inject at the site, or you should inject it at the site. It's been shown like 10 to 15% more efficacious at healing that area. But it also helps with Crohn's, ulcerative colitis, like all these things that are going on in the gut.
Oh, wow.
Yeah, so I have a couple people that are, for their Crohn's, they, instead of their medications, that are using this and like no more flare-ups and things. But really it's being used for, or it's actually been banned by the professional and college level sport world as a competitive disadvantage.
Is it really?
Or competitive advantage. Yeah, because, which I don't understand. In the NFL, everybody could afford it. So, NCAA, I might get that. But it'll promote angiogenesis, so growing new blood vessels. So
Really?
More blood flow in, more toxins out, blood's the highway for all that stuff. So, and then it also helps like bones heal. It helps ligaments, tendons, muscles, all that.
Yeah.
A lot of people, now it's like before going to get surgery, you just do that and, it could help at least take a shot on it, right?
Yeah.
Like some things it's like, all right, it's torn, like go get a surgery.
Yeah.
But this like I would say it starts working quick too.
Yeah.
The half-life of it is 4 to 6 hours, 4 to 8 hours. So it gets in, it works, and it's out. That's why you got to inject that one every day.
The BPC-157?
Yeah. And then like TB-500, which is also great. Not as effective as BPC, but when you pair the two together, it's like supercharging it and you heal. That's the best way to heal there. And
I've tried that combo before. It was pretty awesome.
Yeah, and they call it the Wolverine stack or whatever.
Wolverine stack, yeah.
But then you see these places that are, using that as like a sales tactic, and they put the BPC and the TB-500 in the same vial.
Oh, really?
And, BPC is like injected every day, 5 days a week, 2 days off. But the TB-500 is like twice a week because the half-life is, like 3 to 6 days, something like that. So half-lives you're dealing with are different. You got to inject them separately. But they put it in the same vial, and then you're doing it every day.
Oh, geez.
Yeah. So, I mean, peptide, it's like the wild, wild west with the peptides. Yeah. Everybody's got different protocols and dosings. And I always like to look into like what William A. Seeds is doing. He's kind of
He's
like the
awesome.
expert. Yeah, he's the expert. And like the International Peptide Society, and you just, there's so much information out there. You just gotta like know like where you're getting it, and know like who's saying it, what the protocol is, what the actual research and science is, which is tough right now because a lot of it's in animals, a lot of it's not in humans and all that. So
I always say that the science is always so far behind the practice, or the art of all this stuff.
Yeah, but anecdotally, BPC is like top, helps everybody.
Oh, that's awesome.
Yeah, like no side effects. I mean, I think like mild headaches, mild nausea, things like that. But that's like the rarest of the rare.
Yeah, I've never had any symptom from it. I've done it a few times when I've been banged up.
Yeah, other peptides, like for sure, like you gotta be careful. There's other symptoms like GLP-1s, for example. Like you might have those waves of nausea, discomfort, can't do it.
Yeah, I've even heard like a really bad acid reflux. Like they have shot for some people that've been trying it at too high of a dose.
Yeah, but the BPC is like nothing.
Yeah,
it's great, and you start feeling better quick.
My son got hurt in football a couple weeks ago, like a grade 2 MCL sprain, so a slight partial tear.
Yeah.
And someone recommended you should load him up with BPC-5. I'm like,
you're like,
I'm not shooting up my 9-year-old. Yeah. Like he's young, he'll heal super fast.
He's fine. He's fine.
Yeah. But,
no, he still has, like you were saying with the mitochondria, he has all the pieces in your body that are going to heal it. What, like I said earlier, like when you turn 30, 35, you start losing these things. Not to say that it won't help like a 20-year-old, but 9, I think you're good.
Yeah, 100% he's good. Yeah. Oh, it's just an idea. I can speed things up. The 90s gonna be good. Are there any other healing peptides out there? That
I would mention KPV.
I've tried this one too.
Yeah, so that one's immunomodulator, so it's gonna help boost your immune system.
Yeah.
Also helps with gut stuff. Like I was saying, like you gotta like cycle off these things. Like TB-500, you want to do like 4 to 6 weeks and get off of it, and then you typically want to cycle off as long as you were on.
Gotcha.
So, if somebody's dealing with Crohn's and they're doing BPC-157 and they've done it for 4 months, you don't want the body to get desensitized to it.
Yeah.
Basically, like testosterone,
Yeah. Or supplements in general, right? Like
exactly.
you take the same supplements every day, eventually the body stops responding to them.
Exactly. So you can do like a cycle where it's like, okay, you're doing BPC-157 for 4 months, and then you switch it to KPV for 4 months, and then you could kind of like swap it like that. But with like getting sick, and it's really used a lot post-surgery.
Yeah.
Which you could imagine these peptides are great. They especially like, BBC works very well with this too, but TB-500 is known for wound healing. So healing wounds, and then doing KPV too right after surgery. So, low risk of infection and things like that.
Oh, interesting.
Yeah. And just sickness in general,
Yeah. I did KPV, right?
Yeah.
Had COVID real bad. The COVID was not bad, but I ended up with that long COVID or whatever.
Yep.
I felt horrible, and I got put on that, and it turned me around. It turned the corner for me really quick. It was really nice for that. Yeah, so somebody just, hey, this might help. Let's just see what happens. Yeah. And so I did it, and it really had a positive impact on that.
A lot of people are still dealing with that.
Yeah.
They've said like monoclonal antibodies help, but you can't get them.
Yeah. Yeah.
But that's interesting.
Yeah, I was really happy with how I felt very quickly after being on KPV.
Good. I have a client that's been dealing with that for like a year. So I'm gonna go ahead and try that.
Yeah, it was horrible. They didn't know if it'd work or not. I'm like, I'm willing to do anything right now to feel better from this, whatever this is. Because it was just, I had no energy, no drive, just felt like garbage.
Yeah.
I wasn't coughing, wasn't sick like that, but just I knew something was wrong. And I turned the corner really quick once I started taking that for a while.
Damn.
I was on one cycle of it. It was like maybe 6 weeks. I don't remember how long it was.
You're like, I feel good. We're good.
Yeah, we're good. And so I haven't been on it since, but I remember that being recommended to me.
Yeah.
And then there was another one called like Thymosine A or something like that.
Yeah. So you have your Thymosine. I think it's Thymosine Alpha 1 or something.
Yes. I think that's what it was.
Yeah, they're studying that one for like cancer and things like that.
Oh, really?
Because your thymus, I'm going back to your kid, like, when you're a baby and a kid, you have a thymus gland, and it's big, and it's producing, this peptide, going through the body, healing, like making sure everything's good. As we age, it's like nothing, so putting that in there. I'm not too familiar with that one, but I know they are doing studies for like cancer and stuff like that. Yeah.
Yeah, like I said, I was at a point where I was willing to try anything.
Yeah.
And there's not a lot on this one, but some possibilities. Like, just give it to me. I'll try anything right now. It's better than how I feel.
Yeah, it's a safe one too, so it's not.
Yeah, that's what they said. There really was no negative risk with it.
Yeah.
They weren't sure if it would help at all, but they just threw it at me, and I'm like, I will try it. Yeah.
And then in 6 weeks, you were good?
Yeah, 6 weeks I was dramatically better.
Love that.
Yeah, so, and haven't gone backwards since I did it. So whatever it did for me in that long COVID state was really nice.
That's the best part about it, like not having to be on it. You know, like BPC, like you heal, whatever it is, and then it's not like you get off of it and then you're, injured again.
Yeah.
It's like it is going to heal.
Yeah.
I have a client who couldn't put their arm over their head and then took it in 1 week, could put his arm over his head without pain.
Oh, that's awesome.
And then in a month, he was doing dead hangs and,
Really?
he actually, I mean, this is all anecdotal, right? But he has pictures, and his left shoulder was the injured shoulder. And after 2 months of doing BPC-157, his left shoulder was more defined than his right shoulder.
Oh, wow.
And because he was injecting it here.
Oh, directly into the, that's right. You said that earlier.
Yeah. So blood flow, and just like all, it's crazy to think about, anecdotal, of course, but, like it's like, that's really, I mean, there's tons of studies on it and like mouse models. They're working on human studies. There are some. It was developed in Croatia, but there are some studies, but we need more for everything. But
because peptide, they're pretty new to the marketplace.
Yeah, kind of like.
I mean, they've been around for a long time, but the awareness of
the marketplace, like insulin is a peptide, and discovered in the 1920s, and then the muscle building peptides were utilized from the Russians. I think Vladimir, I forget his last name. But he developed it in Russia, and they're using it on their what was it, like all their soldiers and things.
Really?
So that was being highly used over there, and then since everything's kind of blown up.
Gotcha.
Yeah.
It reminds me of Rocky IV when he was fighting the Russian, and the Russian was getting injected with everything under the sun.
There it is. That's what it is.
A lot was created in that world.
Yeah, they were probably doing it in the Olympics too. Who knows?
Yeah, I'm pretty sure of that. Let's talk a little bit more about the muscle building peptides.
Yeah, so you got a lot there. You have tesamorelin, one of my favorites, because it also helps get rid of the visceral fat. You have your ipamorelin, sermorelin. We don't carry that one, but sermorelin, I believe it's called. MGF, IGF-LR3. So kind of like, you have your sermorelin, your ipamorelin, tesamorelin. Those are all stimulating your pituitary gland to release more growth hormone naturally.
Interesting. Okay.
So more growth hormone in the body, obviously building muscle there. Ipamorelin has an aspect to it where it's going to increase your appetite. And then when you get into like the MGF or the IGF-LR3, those are helping repair muscles. So they actually help you repair your actin and myosin. And you know that, like, you repair that quicker. What we're doing in the gym is tearing that up. Yeah. So rebuilding it faster, you're going to be less sore, and you're going to be able to rebuild your muscle faster.
Yeah. So for the listeners, like, what's the difference between what you're talking about now and taking something like growth hormone or testosterone? Like, what's the difference between the peptides that are stimulating this and taking, like, for example, the synthetic forms?
So if you take like HGH, it's exogenous, right? You're putting it in the body. It might even tell the body to stop, like, oh, hey, we got enough. Like, let's stop producing it. And then this is a more natural way where, like I said, the peptide is a signaling molecule. So it's going to go into the body, and all the pituitary knows is that, okay, there's tesamorelin present. We're releasing more growth hormone, but it's all your own natural growth hormone.
So they're basically telling your body to produce more of its own.
Yeah, and I like, the main issue is like the pineal gland, or the pituitary gland rather, is it like stops releasing it as much.
Yeah,
it's still kind of making it, but the release of it kind of goes down because these peptides are going down and you're not releasing as much of it. But you get that peptide in you, and then it's like, oh. And then it starts releasing more of it. Yep.
Interesting.
Yeah.
So it's fascinating. All the things we're talking about, all the things that begin to slow down as we age.
Yep.
which then makes it harder to put muscle mass on, harder to drop body fat, harder to heal faster.
Mm-hmm.
So peptides are really like, I mean, they obviously fall under anti-aging. It makes sense.
100%.
Yeah.
Yeah, but like again, like diet, sleep, exercise, getting those things like down before you get on this, path to optimize. And I feel like so many people just want to take the cheat code and just be like, I'm going to take testosterone and I'm going to build a bunch of muscle, but they're not in the gym. They're not sleeping right. They're not eating, the right amount of protein or the right foods in general. So you really need to optimize the body, like with your basics before you get onto these things.
So if the foundation is there, the stuff's kind of a waste of money.
And they'll still work a little bit, but they'll be most effective if you got all those things in line.
Gotcha.
Yeah.
Gotcha. Awesome. What are I keep hearing some of my female clients talk about like a copper peptide or something.
GHK-CU copper.
Yeah. What is this one about? They're all fired up about this.
That one helps stimulate like collagen production.
Okay.
So skin, hair growth, all those kind of things. There's like creams for it. There's injections for it. The injections work better. The problem with the injection is that it burns a little bit.
Okay.
Introducing that copper to it, it's a copper ion and it makes it a little more acidic, so it kind of burns.
Oh, gotcha.
So, but they're dealing with it for the beauty,
Yeah.
But what's really cool about that one is it actually has also been shown to regrow new blood vessels, and it's also been shown to help with cellular health.
Really?
Yeah. So it's not just the collagen production you're getting there, but yeah, hair growth. People are obviously want that, and then also just wrinkles and skin tightness and elasticity and stuff like that.
So you've brought this up a few times about the increasing blood vessels or creating new blood vessels.
Yeah, angiogenesis.
Angiogenesis.
Yep.
What is the benefit to that for people?
So, I mean, your blood is the highway for toxins. It's the highway for nutrients. So, where your blood is going into your body, we're not just talking it's not growing new veins and arteries. It's growing all the, small little capillaries and things. So, the reach of your blood is like way better. I mean, like in injuries, if you injure a tendon or ligament or something like that, the blood flow is not as good, and some of them it's harder to heal. Yeah. So the more it's because they're not getting that blood, they're not getting things to fix it or things to take away the bad stuff occurring there. So you get more of that blood flow, surround it with help, and then you're healing quicker.
Interesting. So it's funny you say that because my son with his knee injury, that partially torn ligament, they have him in the pool every day doing movements to generate that blood flow to the area to vastly enhance the recovery.
Exactly.
It sucks for him, but it's doing that exact thing you're talking about. So if these people can start to grow more blood vessels, this type of thing is going to naturally start to happen. Yep. They're going to get better blood flow throughout the whole body, better cleaning out of the toxins throughout the whole body, which I love that idea because we live in the most toxic environment ever. Yeah. People are dealing with toxic overload crazy, and they don't even know it.
Yeah, detoxing is the biggest thing now.
Yeah.
Like we almost got to bulletproof ourselves for everything that's out there. You know? Everything we eat, everything, this is a little off topic, but I was listening to a podcast and, I think America has about 14,000 different food chemicals and foods that we're allowed to put into our foods. It used to be 700.
Oh my gosh.
You look around the world and every country is still at 700.
That's crazy.
So, so we don't know, you can't read the back of a label. You don't know what these things say. So we're constant. And then in our water, like chlorine gets absorbed by the body like crazy. Yeah. It's all in our water. It's like we're getting hit from every aspect. So we got to detox.
It's funny. One of our clients just moved over here from London not long ago. I think it was London, somewhere over in England. And, she's like, I don't understand what's going on. Like, I haven't changed anything from how I ate when I lived over there to how I eat now. Yeah. But I'm putting crazy amounts of body fat on. I feel horrible. I have no energy. My digestion's all wrecked. What is going on? That is perfect example of she's eating the same foods, but it's so much more processed here. There's so much more crap in it that is destroying her health. Yep.
And I mean, you hear the opposite of that when we travel to Italy or whatever. They're like, I ate pasta and I was fine. Yeah. Like everybody's got these gluten allergies, but do we? Or, like
Yeah.
what's going on? Like in 95, they passed this thing that we could spray folic acid over everything. Like the wheats and the rice and all that. And now they call it fortified and enriched.
Yeah.
But like a bunch, I mean, I don't know if you've heard of like the MTHFR gene, but like 40% of people can't process that stuff.
Yeah.
So it's causing all these issues, and they're spraying it for everybody unless you go organic, and what even is organic these days, right? So it's wild. Like the guy brought up Fruit Loops, one in Canada, one in America, and it's like the one in America has all these different color dyes and all these things. In Canada, they're using like blueberry juice to color it, carrot juice, watermelon juice. It's like all this healthy stuff. Yeah, there was just a Senate hearing, which was really cool, where like all these great minds got together and were able to talk about all this stuff. And now there's like riots in front of Kellogg's. So things are happening. Things are changing. I think we're all kind of waking up to it a little bit.
Yeah. I think people are becoming more and more aware of it.
Yeah.
I feel the most pain for our children because their bodies don't know how to deal with it.
Yeah.
I can watch my son when he eats certain things, his body reacts horribly to him.
Yeah,
not allergic reactions, but I can just tell when his body there's something in a food that his body doesn't like.
Yeah, and then all of a sudden, all these kids are getting diagnosed with ADHD and stuff when they really don't have it.
Yeah,
it's like it's the food we're eating.
Yeah, because so many of the foods are neurotoxins, right?
Yep.
So many of these chemicals.
Yep.
Yeah, they just don't know how to self-regulate themselves.
Known neurotoxins.
Yeah,
and it's just like, all right, FDA cleared it, we're good.
Yeah, that's scary.
Yeah, it's bad.
Any other like beauty type of peptides?
I wouldn't say like indirectly. I would say like there's obviously the GHK-CU, but there are those there's two peptides I really like for just overall wellness. And that's MOTC and Epitalon. MOTC, we talked a lot about the mitochondria, is just like supercharges the mitochondria. It makes the mitochondria a lot more efficient.
Oh wow.
That's one that you'd want to cycle like 3 times a year.
Okay.
For like 2 months at a time. And then there's the Epitalon, which do you know about the telomere in the cell?
Oh, yeah.
Yeah, so, it's basically your blueprint. Your cells are constantly duplicating. The telomere is basically the blueprint to tell what it's duplicating into, what to build. That gets cut off and shortens every time that cell duplicates. Your son's going to have a long telomere. An 80-year-old's going to have a short one. You have less of a blueprint to tell your cells how to work, and your body starts breaking down. It's kind of like a biomarker for aging. Epitalon's been shown to grow the telomere.
Interesting.
As well as like cold therapy, heat therapy, like some of those things have been shown too. But yeah, the Epitalon is like two to 3 cycles a year as well. And it's like 20 doses. It burns. It's not that comfortable. But yeah, they've even been shown like a reduced risk in cancer and all-cause mortality and that kind of stuff. Yeah.
Oh, that's really cool.
So and this stuff is all new still, but those studies are coming out, and it's a really exciting field.
Yeah.
Peptide. I think eventually peptides will all be like oral form.
Okay.
It's just a matter of researching them and getting the right mix in so the gut doesn't break it down.
Yeah, gotcha.
But right now, it's pretty much all injectable.
Yeah, that makes sense because people do not like injecting themselves.
Yeah. And it is a little tiny insulin needle. You barely feel it, but still,
Still a thought.
Yeah.
I'm fine because I've done it for so long with so many different things, like B12 injections, all kinds of different things.
Yep.
One other thing I know that people are really excited about at your facility is the hyperbaric chamber. Mm-hmm. Tell us a little bit about that. Like, what are the benefits of hyperbaric chamber?
Yeah, so similar to the NAD that works at the cellular level, and it's the precursor to the body's energy, ATP. Oxygen is also needed to create ATP. I believe it's 38 ATP produced per cycle with oxygen, 2 without. So a good analogy I like to use is going up into the mountains. You feel fatigued, you feel low energy, you might get a headache. The difference there, it's the same amount of oxygen, 21% here and 21% there. There's less pressure up there. So when your diaphragm pulls down, your lung expands, and whatever pressure you have available to you wherever you're at is how much oxygen and air you're going to get into those lungs. So the opposite of being in the mountains is hyperbaric chamber. Pressurizes the environment, and also you got a mask on, you're getting about 80 to 90% oxygen while you're in there.
Oh, wow.
So every breath you take is super saturating the body with oxygen.
Interesting.
Yeah, so same kind of benefits as NAD, mental clarity, less inflammation, performance, energy just throughout the day. Sleep gets way better. I track it on my Whoop.
Yeah.
And I do it about 3 days a week before I start working. And I notice on my Whoop, my deep sleep goes up like 30, 45 minutes.
Really?
On those
That's
days.
the thing I see people struggle with the most that use like the Whoop, the Aura Band, things like that, is they have a hard time with the deep sleep realm.
Yep, exactly.
Really?
And that's a cool thing I like these things for, is like being able to try new things and like see how it affects your sleep. And sometimes it might just be a good night of sleep, but I've been pretty consistent with it, and it's crazy how it helps. I'll do breath work with it in there, I'll meditate in there. So that might have, an effect. I do more breath work and meditation on the days I'm using that.
Yeah.
But yeah, it you feel good after. And injuries too. They have at Hogue, they have a whole floor of them.
Oh, really?
And they use them for burn victims.
Oh, okay. I've heard about that.
Yeah, there's like a study done, I think 3 days a week, and it heals them 50% faster.
Yeah, I think you might, I don't know if, I thought that I heard at some point, a combination of using people with Parkinson's, if they used, injected glutathione and then got in the hyperbaric chamber, a dramatic reduction in their, the quivering they have, or whatever it's called. Have you heard anything about that?
I haven't heard of that, but that's awesome. Like I would love that.
Yeah, I'll find the doctor. As a doctor I used to follow. I just remember watching a video of a guy that had Parkinson's. I'm pretty sure I know it was glutathione. I'm pretty sure it's a hyperbaric chamber. I'll find it and shoot it over to you.
I've heard a lot of good things about Parkinson's, and even like if you get a stroke and you go in the hyperbaric chamber, like quickly after, you could reduce a lot of the symptoms of that stroke.
Yeah, there's a doctor in New Orleans. A client of mine's father had a stroke, and he got someone I knew referred him to a doctor in New Orleans that used hyperbaric chamber for stroke victims.
Yeah, it's crazy.
And how long should people use the hyperbaric? Like, what's a good protocol for the hyperbaric chamber?
So I say for like maintenance, like 2 times a week for an hour is good. Like 3 times a week, I have people in there 5 days a week. If you got something coming up, like a performance, do it like the day before or something like that. If you're healing, do it, couple days after. But yeah, the maintenance is like around, at least 1, but 2 would be solid.
Interesting. I've actually never been in one of those.
Come on
I
in.
know, I need to come do that.
We get a new one next week.
Yeah, nice.
It's a 2-person one, so claustrophobia is not an issue.
Oh, good.
It's got a TV in it.
Really?
Yeah.
Oh, that's smooth.
We go hang out in there.
I love it.
Do a podcast in there.
That would be fun.
Yeah.
Can we do that, Caesar? A podcast in a hyperbaric chamber.
Yeah.
That might have to be our new studio.
Yeah, right. Pod talks or whatever.
Highly oxygenated.
Yeah.
Man, this is a fascinating topic. The topics I love go so fast.
Oh yeah, they do.
That's sped fast. Well, man, thank you. I appreciate you coming on and just kind of sharing some insight in all these things people are hearing about, and get a little understanding of the different categories there are, how to use them, what they do, being insightful around how you should cycle them. Like, I think that's really important because no one's really talking about that.
Yeah.
I see all these places that have like these membership options where you pay a monthly fee and you get it every week.
Yeah.
Or every month or whatever it is. But there's no stop to it. There's no education around how to cycle things and how to stay on them, get off them. I love that you emphasize so much the lifestyle factors that have to be in place for these things to really be effective.
Yep.
And so I hope that people are listening, that you hear that if you do want to explore these things, the lifestyle things have to come into play. This whole idea of using them as a cheat code, that's not a long-term answer.
Yeah.
It'll work. You'll get some benefit from it, but it's not the long-term answer. You can't beat a healthy lifestyle.
Yeah. You want to use these peptides like, there's the, cycles 3 times a year, doing those, but a lot of them are kind of like how you're feeling. Like, I want to lose some weight. I want to put on some muscle, but you don't want to be on these things forever.
Yeah.
I had a client that came to me and she was on the IGF-LR3 for 3 years straight. Wow. And I was I was like, whoa, I showed her all the studies because, you know, you do something that long that's helping grow muscle, your heart's a muscle.
Yeah.
You know, like organs are all made of muscle. So you want to be careful with the cycles you're doing them on. It's safe to do it in short cycles and get off of it. But yeah, she tried to get off of it and her joints were all messed up. She didn't feel good. It was like she got back on it.
Oh my gosh.
And her doctor told me, I told her all that information. I sent the studies. And she told her doctor about it. He said, I don't know what I'm talking about. And I'm not a doctor.
Yeah.
You know, I just am really interested. I read books, podcasts, the studies, all that kind of stuff. He told me I didn't know what I was talking about. He's like, I handle 10,000 different people's protocols and he doesn't know what he's talking about. I was like,
yeah.
All right.
Yeah. But you have medical backing at your organization, right?
You
have,
we have a medical director.
And...
We got 3 NPs that are, you know, approving all these things. I have RNs administering everything and a phlebotomist on staff as well.
Love it.
Yeah.
It's funny, so often, and I'll just be honest with this, so often the most educated people I find in these different arenas are the people that are fascinated by it, not so much the doctors using it.
Yeah. Well, they don't have time.
Yeah, that's every doctor I talk to is like, I would love to learn more. I just don't have the time. I'm too busy with patients. And
it's the way it's all set up, right? Like they go to school for, you know, curing disease and reading a blood chart and seeing where they could give medicine.
Yeah.
And it's not their fault. It's just the way it's all set up.
Yeah,
you know?
the ones that can break away and get more into the naturopathic medicine, the functional medicine, they tend to find they have more time because their structure is different. It's not run through the insurance. So that's one of the, yes, it's more expensive, but the value is so much better because they have the time to look at the research, to dive deeper versus just trying to pump and dump patient after patient after patient after patient.
And they have
just
to
so
do
they
that.
can
Like the average time is what? Like I think 6 minutes a doctor sees you.
Yeah.
Because if they don't do that, they don't make any money.
Yeah.
You know, you have cash pay. You get way better service.
Yeah.
You get a passionate individual.
Yeah.
You know, like physical therapists, right? If you go to physical therapy on insurance, you're going to spend 15 minutes with that physical therapist and the rest is going to be with the aide.
Yeah.
You do cash pay, your whole hour is with that physical therapist.
Yeah.
You know, it's the same model.
Yeah. Yeah. Everybody I see that I really like is all cash based.
Yeah.
If I got a problem, I really need to be fixed. But you know, then I go see my normal doctor for the normal. If I got a cough or something like that,
it's like car insurance, right? You know, if you get in a car crash, you need that car insurance. But your oil change and your tire rotation, like you're paying a lot of that stuff out of pocket to keep the health up.
Yeah.
You know,
Yeah.
We check the oil in our cars. We got to check the oil in ourselves, right?
Yeah. Well, hey, man, thank you so much. I'm a big fan of peptides, if you couldn't tell. Like, I've played around with a lot of them over the years, so I was super excited to have you come on and talk about them. So thanks for taking the time, man. Really appreciate it. It was great seeing you.
Yeah.
Great hanging with you.
My pleasure.
All right,
my
man.
pleasure.
Take care.
All right. Later.